As an important part of the healthcare team, we would like you to be aware of hospital policy and resources available to you as you navigate through potentially complex hospital systems. In this video, we'll cover hospital policy and procedure related to select areas of documentation, what needs to be in order before sending a patient to surgery, and a brief overview on the hospital emergency codes. Aside from the obvious requirements for legal protection and financial reimbursement, documentation is crucial for the coordination of quality care and patient safety. Before sending a patient to surgery, the following must be accomplished. First, informed consent must be obtained and must be in the patient's medical record. The informed consent is considered to have continuing force and effect until revoked by the patient or until circumstances change that may affect the nature, risks, or alternatives to the procedure or therapy to which the patient has consented. It is, however, recommended that consents signed more than 60 days prior to procedure should be redone. You may use the iMed consent system for this process. The nursing staff is available to witness the patient's signature. Keck Medical Center of USC has a large transfusion-free medicine program. For these patients, there are separate special consent forms that ask the patient to inform the healthcare team of their specific wishes related to acceptance of blood and blood products. If you need assistance talking to a patient in the transfusion-free program, please ask the nursing staff to introduce you to the program director. In some situations, the person legally authorized to give informed consent may only be available via phone. In this case, a nurse may be on the line with you as you provide information and obtain consent from the patient's legally authorized representative. You and the nurse will then sign the consent form. Many Spanish language consents are available via the iMed consent system. For any of the non-English language consent, you will need an interpreter that has been certified by the hospital. The nursing staff can assist in locating an interpreter. If there is not an appropriate interpreter on duty or immediately available, the nursing staff will contact a certified medical interpreter available 24 hours a day via phone service. A complete history and physical or an update of one that was completed no longer than 30 days ago must be in the patient's medical record within 24 hours of surgery. The nurses in pre-op may contact you to make certain the H&P meets requirements. Finally, orders to transfer the patient to surgery and for any preoperative antibiotics or other medications must be written. Hospital policy requires that the physician or physician designee performing the procedure shall clearly mark the procedural site with the word yes. Marking should take place in collaboration with the patient who is awake and aware. Emergency codes can vary between hospitals, so we would like to introduce you to the emergency codes in use at Keck Medical Center of USC and let you know what to expect when a code is called. Here are a few of the most commonly called codes at Keck and Norris hospitals. Code Assist is for help lifting or transporting a patient with special needs. Staff that have been trained to lift and move patients will respond. If you're not directly involved, continue with your own duties. Code Blue is a medical emergency for cardiac or respiratory arrest. A trained team, including physicians, nurses, a respiratory therapist, and a pharmacist will respond. The patient's primary medical team will be immediately notified. Code Gray is a security incident. Unless you are directly involved, please stay away and help keep others clear of the area. Code Green is patient elopement. Only the CEO or nursing supervisor may initiate this code, and a select trained team will respond. Code Pink means possible child abduction. Doors to the buildings will be locked and monitored by security. Pay particular attention to adults with small children and report any circumstances that do not seem right. Soon, all of these protocols will become second nature, and as you continue your professional career here at Keck, you'll learn many more procedures and systems that are unique to Keck and Norris hospitals. We welcome your comments and suggestions about ways we can improve the care and service we provide. Please contact the Keck GME office at any time.